People with disabilities encounter a variety of barriers when it comes to accessing healthcare services. These barriers can be physical, financial, systemic, and attitudinal, creating significant challenges in receiving timely and appropriate care. Disability history is marked by a legacy of discrimination, exclusion, and neglect, where disabled individuals were often viewed through a lens of pity, charity, or medical pathology rather than as full and equal members of society. This historical context has shaped societal attitudes, policies, and practices regarding disability, which contributes to persistent barriers in healthcare, education, and employment, along with housing and community participation. The truth is that people with disabilities only gained equal rights roughly 30 years ago. The disability rights movement, which gained momentum in the mid-20th century, played a pivotal role in challenging ableism, advocating for civil rights legislation and social inclusion for individuals with disabilities. Key milestones in the disability rights movement include the passage of the Americans with Disability Act, also known as the ADA, in 1990, which prohibited discrimination against individuals with disabilities in terms of employment, public accommodations, transportation, and telecommunication. Despite these legislative achievements, however, there is still a lot of work to be done, especially in bridging the gap between accessibility and equitable healthcare. Disabled individuals continue to face unique challenges in accessing healthcare services, receiving appropriate accommodations, and navigating complex healthcare systems that may not always be inclusive or responsive to the diversity of their needs. The historical legacy of neglect and marginalization has left a lasting impact on those healthcare disparities, health outcomes, and overall quality of life for individuals living with disabilities. Although healthcare should be a basic right for everyone, this pervasive lack of access to inclusive, accessible, and affordable healthcare is significantly impacting people with disabilities' quality of life, while confirming their mistrust of the medical system as a whole. According to the CDC, which is the Centers for Disease Control and Prevention, approximately 26% of adults with disabilities report experiencing constant barriers to healthcare access, which can include affordability, transportation, and inadequate provider accommodations. These barriers can lead to delays in receiving necessary medical care and preventative services. Also, adults with disabilities are more likely to have chronic health conditions, such as diabetes, heart disease, obesity, and hypertension, compared to those adults without disabilities. For example, 35% of adults with disabilities, compared to 9% of adults without disabilities, have diabetes. Mental health disparities are prevalent among individuals with disabilities as well, with higher rates of depression, anxiety, and unfortunately, suicidal ideation reported within the population. Approximately 36% of adults with disabilities experience frequent mental distress, which is compared with only 11% of adults not living with disabilities. Physical and environmental barriers continue to contribute to healthcare access challenges for individuals with disabilities. In fact, only 18% of healthcare facilities in the United States have accessibility issues such as lack of ramps, narrow doorways, or inadequate accommodations for individuals with mobility aids. That number needs to be better. These statistics underscore the urgent need for all of us to address healthcare disparities, improving accessibility and promoting inclusive healthcare practices for individuals with disabilities living in the United States. By adopting a person-centered approach, integrating disability-inclusive policies and services, enhancing healthcare provider training in disability awareness and communication, and fostering accessibility awareness as well, we can and will work toward reducing disparities, which will improve health outcomes and ensure equitable access to healthcare for all individuals, regardless of their ability levels. The truth is that addressing these barriers will require a multifaceted approach, that involves collaboration among healthcare providers, policymakers, advocacy organizations, and most importantly, including those with disabilities themselves. Some key strategies can include the following. We must improve physical accessibility. Healthcare facilities should be designed and equipped to accommodate individuals with disabilities, including accessible entrances, exam rooms, equipment, and signage. We must train healthcare staff on disability etiquette and best practices in order to provide care to individuals with diverse needs. That care is essential. We must enhance financial accessibility for those living with disabilities. Efforts need to be made to reduce financial barriers by expanding insurance coverage, providing much-needed subsidies or discounts for healthcare services and assistive devices, which can be cost-prohibitive, and ensuring that cost is not a deterrent to anyone accessing necessary care. Additionally, exploring innovative payment models that prioritize value-based care and outcomes can and should improve affordability and healthcare quality for those living with disabilities. We must address systemic and policy barriers. Healthcare systems and policies should be designed and implemented with a focus on total equity, accessibility, and inclusivity. This includes incorporating disability perspectives into any healthcare planning, developing and enforcing accessibility standards, improving care coordination and communication, while promoting cultural competence and sensitivity among healthcare providers and staff. Combating attitudinal barriers is also a must. Education and awareness campaigns aimed at challenging stereotypes, combating stigma, and promoting disability rights and inclusion can help change attitudes within healthcare settings and society at large. If we provide training and resources on disability awareness, along with communication strategies and patient-centered care, we can work to empower healthcare providers to deliver more inclusive and respectful care to individuals living with disabilities. Another important aspect is to host listening groups. Creating a space where people with disabilities can share openly about their experiences will allow health professionals and systems to learn firsthand what changes need to be made so that the disability community can feel safe pursuing and obtaining the care they deserve. There are many organizations currently working to address these complex and ongoing barriers that exclude people with disabilities from gaining proper health care. For example, I'm Devon Anderson, and I work as the engagement coordinator here at the American Association on Health and Disability, also known as AAHD. We are a national cross-disability nonprofit organization dedicated to ensuring health equity and inclusion for persons with disability. We accomplish our mission through research, advocacy, education, policy, and knowledge translation efforts at national, state, and community levels. Since 2018, AAHD has been supporting outreach efforts for the NIH All of Us research program. We are currently leading a network of 20 national and local disability groups in this effort. As I stated earlier, the disability has historically and continually been left out of health research, and the All of Us research program really seeks to change that. All of Us honors the disability movement's central mantra, which is nothing about us without us, by inviting people with disabilities to contribute to research findings that may lead to more tailored healthcare for them and others in the future. In 2022, we launched our inclusion statement, No Research About Us Without Us, which called on the disability community to be a part of All of Us and join the voices much needed in health research. This statement was developed by us with input from people across the disability community to build a vision for inclusive health research. In this, we highlight what All of Us is currently doing to engage people with disabilities and share best practices for accessible engagement within our communities. We highlight our vision for inclusive health research that supports the enrollment of all people with disabilities, including those who may not be able to consent to participate on their own. You can help make health research more inclusive by joining the All of Us research program as well. The program's goal is to collect data from 1 million or more participants on a wide range of demographic, social, environmental, and health factors, including disability status. This program seeks to address the gaps in knowledge and improve healthcare access for individuals with diverse needs. Thus, by joining the program, you can help raise awareness about the need for personalized healthcare that could benefit everyone. This year, we also launched a Disability and Health Conversation series to build awareness of some key health concerns within the disability community. We have talked about topics including intersectionality, the health needs of diverse disability communities, and mental health. We view these conversations as a way to share a vision for disability health that helps shape what research is happening on the data workbench, and we really hope to see more studies that examine disability health needs. In the end, we believe that by addressing these barriers comprehensively and adopting a person-centered approach to healthcare, we can work to create a more accessible, equitable, and inclusive healthcare system that meets the diverse needs of all individuals, which includes those with disabilities. This care not only improves health outcomes and quality of life for individuals with disabilities, but also contributes to a more just and compassionate society where everyone, no matter who they are, has the opportunity to thrive.